Hello and welcome to JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Dr. Lyndsey Darrow about preterm and early term delivery following heat waves in 50 U.S. metropolitan areas. Welcome. To begin, can you please introduce yourself?
Yes, this is Lyndsey Darrow, and it's really great to be here. I'm a professor of epidemiology at the University of Nevada, Reno.
So I want to start off by saying this was a really interesting study. I really enjoyed reading it, and I think very timely as well. Can you discuss a little bit about its background?
Yes, well, of course, as we're all experiencing, heat waves are becoming more frequent and lasting more days and often breaking temperature records. So we were motivated to try to better understand what risks this poses in pregnancy. And particularly, there are a number of plausible mechanisms by which we might think there are actually acute effects of heat waves on these birth outcomes. Preterm birth being birth before 37 completed weeks of gestation, and early term birth being birth between 37 and 38 weeks gestation, which is not as extreme as preterm, but still actually those infants experience more health risks than their counterparts that are full term after 39 weeks. So we thought we should try to better understand this with a particular look toward some of the more extreme heat waves that have occurred historically to tell us, what that might mean for the future and what we might see.
That's great. Can you tell us a bit about the data that you used for the study?
Yeah, so we utilized birth record data for the U.S. that are housed at the National Center for Health Statistics. So that's part of the CDC. And specifically, we looked at births between 1993 and 2017 in the 50 largest metropolitan statistical areas. So these are the urban areas, but also the suburban sprawl areas around those urban centers. And that included about 53 million births. So really large sample. And importantly, a really long time period. So that's a 25-year time period that allowed for enough heat waves and more extreme heat waves to occur and be observed. So yeah, those are the birth data that we used.
That's great. And what were the outcomes you measured in the study, and what did you find?
So the outcomes we were looking at were preterm births and early term births. And what we did is we looked at rates of these outcomes on each day in each MSA, so in each location. So we would count up the number of preterm births that occurred on each day and also identify the ongoing pregnancies on that day that were at risk of the outcome on that day. So we're really looking at rates over time. And then we linked those rates to indicators of heat waves occurring in the last 4 days or the last 7 days. And in terms of our results, well, broadly speaking, we saw that heat waves were indeed followed by an uptick in the rates of both preterm and early term birth. And we saw stronger associations for longer heat waves and also when temperatures were higher during those heat waves. And we also saw that the associations were a bit stronger for that 4-day exposure window, so even closer to the timing of birth, suggesting a more acute type of response. So we did some sensitivity analyses, pretty consistent positive associations for both outcomes. Now, the effect sizes were very small, so on the order of 1% to 2% relative increases in the rates of these outcomes. But when we did look at these relationships within population subgroups, dividing the data into different pregnant populations, for example, by age or by educational attainment, we did see stronger associations in some of those subgroups.
That was actually going to be the next thing I wanted to talk to you about. I thought the findings were so interesting, and I wondered if you could dive in a little deeper on some of those subgroup analyses, particularly those with respect to maternal-specific factors and background.
Of course, when you're doing a study of 53 million births, you're going to have limited detail on exactly, specific characteristics of the individuals. But we did have information that is available on the birth record, like the age of the pregnant patient, the highest educational attainment, race and ethnicity. And so when we looked at the associations stratified by those factors, we saw notably stronger associations among younger patients, so particularly less than 25 years. Those with a high school or lower educational attainment also had elevated risks. Also, among the Hispanic pregnant subgroup and the non-Hispanic Black subgroups. They tended to have stronger association. These are crude proxies for a lot of different vulnerability factors that might be operating in the population, so we can't talk about exactly what is happening here, but there certainly seems to be a signal that is consistent with a lot of other research that's coming out that these possible effects that we see in the population due to heat waves are not necessarily evenly distributed across the whole population.
Absolutely. Really, really interesting work. And I wonder to take a little bit of a broader view here. So at one point you mentioned that the analyses were restricted from May to September. It was designated to be the warm season in the U.S. And I'm wondering, are there any potential implications of this or potentially broader implications from the perspective of thinking about the trajectory of heat waves in the future, and even from a public health perspective?
Well, I will say defining a heat wave is, of course, there's no gold standard definition. So we had, at the onset of the study, we had to make some decisions about what we would call a heat wave, right? That's kind of a two-step process. First, we had to identify what days we consider to be hot, and then identify where clusters of those days happened. And the way we identified hot days is we took the hottest 2.5% of days in each location. Obviously, the temperature for those hot days in Seattle would be different than in Phoenix, for example, but they would be relatively hot for the local norms. Given we defined heat waves that way, pretty much all the heat waves occurring in the period were falling in those May to September windows. There might have been an isolated event or two that occurred outside, but for the most part, we didn't miss many heat waves by our definition. Certainly, what we're seeing is hot days occurring outside the warm season, the temperatures becoming hotter, basically the expansion of the warm season occurring. So I think what we see here is probably relevant to those days that are going to be increasingly hot outside of the traditional warm season.
Right, that makes a lot of sense. So without going too far out of the scope of this particular study, I wonder if you could just say a few words on perhaps some of the implications of this study from a broader public health perspective.
Right. So we could think about this on the individual level, that in the middle of the hottest heat days of the year, it makes sense to potentially, for pregnant individuals, to avoid prolonged exposure to those outdoor extreme temperatures to the extent possible. Of course, this assumes pregnant patients have a way to do that, which is not always the case. And again, this work really adds to the growing evidence that certain subpopulations are sort of experiencing the brunt of some of these exposures. But I think this is really a big picture type question, and heat waves have been increasing in frequency. They're going to keep increasing. We know this. But of course, it remains to see how bad these exposures are going to get, right? And that is to be determined based on our collective action and policy decisions made worldwide. But I do think it is important in the meantime to really try to understand the negative health effects of these extreme heat exposures. Potentially, if we start to understand the mechanisms better, we might be able to target prevention measures to certain populations. But in general, this is one of those exposures that on an individual level, it's hard to prevent.
Absolutely. Before we wrap up, are there any final thoughts that you had regarding this paper or this topic or anything we didn't cover?
One thing I'll mention about this study and also these types of studies is that the associations we're estimating are actually after any behavioral modifications that pregnant individuals are making to avoid the heat, right? So when we do these studies, that's baked into our results. So we're not actually studying the effect of physical exposure to heat because undoubtedly many pregnant individuals are actually doing what they can to avoid heat on those really hottest days of the year. So I think it's notable that the fact we can actually still observe an overall uptick in these rates of these outcomes on the full population level does suggest that there are subpopulations of pregnant patients that are not able to avoid the heat and are experiencing meaningful negative implications of these exposures. I'll note that the U.S. has very high access to air conditioning. It does vary regionally. Compared to, say, Europe, we have a lot more access. So given that these types of studies really are estimated based on all the behaviors happening in the population. Our results are really not necessarily applicable to other places, so I would say that's a limitation. But in a lot of those places, I might expect results to be even stronger, see even stronger associations where they don't have as many options for avoiding the heat.
I think that's a really important thought to end on. Thanks so much to Dr. Lyndsey Darrow for speaking with me today about this very relevant and timely topic. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.